Hello, and thank you for joining us today. I'm Sergeant Sandasha Bao, Media Relations Officer for the London Police Service. Today, we will be speaking to the seizures of guns and drugs since January of 2024, resulting in hundreds of charges, hundreds of thousands of dollars worth of drugs seized, and multiple firearms removed from the street. We will also address the growing concern related to the diversion of safe supply drugs and the dangers posed to our community. We ask that you please hold all questions until the end of the conference, at which point I will go over a few housekeeping items. I would now like to welcome Chief Tai Trung, who will commence the press conference with opening remarks. Chief.
Thank you, Sandasha. I just want to acknowledge Scott Cordes, who's here with us today, Executive Director from the London InterCommunity Health Centre, and Dr. Alex Summers, who's the Middlesex London Medical Officer of Health, who's joining us today. Last year, our community was plagued with gun violence. We had 27 shootings, and we almost surpassed the most shootings that we've ever had in our city's history of 28 in 2021. We know that violence, firearms, shootings go hand in hand with drug trafficking, whether it's at the street level or sophisticated organized crime groups that are involved. Our community depends on us for public safety. Our residents, people who work here, visit, and families that live in our city. Last year, at this very same time, we had almost 20 shootings compared to where we are today. To date, we've only had 3 shootings. This is a tremendous reduction in shootings across our city. I want to acknowledge Deputy Chief Trina McSween, who's here with us today. I also want to thank Deputy Chief Paul Bastian. Under his command, for the past 6 months, our Guns and Gangs section have been working very hard to make our city safe. I'd also like to acknowledge and thank Detective Superintendent Paul Reynolds, Detective Superintendent Chris Cherney, and Acting Detective Inspector Dave Payette. And I'd like to personally thank Detective Sergeant Josh Silcox and his team for the incredible work that this organization has been doing and that this city has been waiting patiently for us to do our part. You're going to hear about the seizures we made shortly, but it's important from a public safety perspective that we identify a growing concern in this community. The diversion of safe supply, particularly hydromorphone. The diversion of safe supply is occurring in this community, and it's impacting the people who live here. Diverted safe supply is being resold into our community, it's being trafficked into other communities, and it is being used as currency in exchange for fentanyl, fueling the drug trade.
Thank you, Chief. Next, we will hear from Deputy Chief Paul Bastian.
Good afternoon. As the Chief mentioned, I'll share some information to illustrate that in the City of London, the diversion of safe supply medication prescribed as part of an opioid replacement program is an unintended consequence of that program. Irrespective of the source, anytime prescription medication makes its way into the hands of individuals other than those for whom it was intended, there are implications to public wellness and safety. Our analysis of trends around the seizure of certain drugs, in particular hydromorphone and Dilaudid 8 milligram tablets, has led to strategic engagement and enforcement action. As a brand name version of hydromorphone, Dilaudid is relevant given its prevalence as an opioid replacement prescribed in safe supply. I'll take a few minutes to go over some historical data that we believe is relevant to the issue and indicative of its magnitude, including data on drug seizures, fatal overdoses, and robberies. The diversion of safe supply medication is an important issue affecting community safety and is cause for concern. In 2019, the London Police Service seized approximately 850 tablets of hydromorphone. Of these, 75, or roughly 10%, were Dilaudid 8 milligram tablets. In 2020, the number of hydromorphone tablets seized increased to just over 3,000, approximately 38% of which, close to 1,200 tablets, consisted of Dilaudid 8 milligram tablets. Hydromorphone seizures increased again in 2021 and 2022, although less sharply, to roughly 5,500 and 6,500 tablets respectively. In 2021, Dilaudid 8 milligram tablets made up 25% of the total. However, in 2022, that figure jumped to over 85%, with the seizure of over 5,500 Dilaudid 8 milligram tablets. In 2023, the London Police Service seized just over 30,000 tablets of hydromorphone in total, 15,000 of which consisted of Dilaudid 8 milligram. During this 5-year period, not only did Dilaudid 8 milligram tablets as a percentage of all hydromorphone seized trend upwards, so too did the number of each drug in absolute terms. So far in 2024, we've seized just over 12,000 hydromorphone tablets, the overwhelming majority of which, meaning all but 675, was in Dilaudid 8 milligram form. Concurrently, we've observed trends in overdose deaths in the City of London between 2019 and 2023. During that time, the total number of overdose deaths rose from 73 in 2019 to peak at 142 in 2021, before trending downwards again for the 2 years that followed. During the 5-year period, the percentage of fentanyl overdose deaths remained static, fluctuating between roughly 80 and 85% of all overdose deaths. At the same time, we've also seen the number of pharmacy robberies targeting opioids drop sharply from 7 in 2019, when a total of just over 1,200 opioid tablets were stolen, to 2 in 2020, and then to 1 in each of the following years up to 2024. Since 2020, fewer than 500 tablets were stolen in a robbery. In addition to the overall seizures, overdose data, and robbery data, we have found direct evidence linking Dilaudid 8 milligram seizures to safe supply. In 26 separate cases, each of which represents one or more search warrants obtained under the Controlled Drugs and Substances Act in relation to a drug trafficking investigation, we obtained direct evidence of diversion in the form of packaging or labeling. Taken together, all of this has pointed to diversion as an important public safety concern, calling for an enforcement response.
Thank you, Deputy Chief. I will now call Detective Sergeant Josh Silcox, head of our LPS Guns and Gangs section.
Good afternoon. I'd like to thank all those in attendance today for coming, as well as all of those of you appearing remotely online for your attendance as well. My name is Josh Silcox. I'm a detective sergeant in the Guns and Gangs section here at the London Police Service. The Guns and Gangs section is responsible for conducting proactive investigations into drug trafficking and firearms-related offenses in London. Our goal is to disrupt, deter, and hold individuals accountable for these offenses and keep our city safe. Drug trafficking poses a safety risk to everyone in our city. Combating drug trafficking is a team effort that not only involves our team, but our community partners and all Londoners. Today you will see the results of the hard work done by our dedicated team of women and men. We are committed to doing our part to ensure the safety and well-being of everyone in our city and appreciate the help we receive from our community in doing so. Since the beginning of 2024, the Guns and Gangs section has conducted numerous proactive investigations into drug trafficking in the City of London. These investigations are conducted throughout the city, as well as the downtown core and Old East Village. Some of the results of these efforts have been shared previously, while others form part of ongoing investigations, which we are now able to share. In total, these investigations have resulted in over $750,000 in drugs seized, and in the process, 50 persons have been charged. Our investigations have resulted in a total of 144 Controlled Drugs and Substances Act charges, 103 Criminal Code of Canada charges, amounting to a total of 247 charges laid. These investigations have netted substantial seizures in drugs and firearms, including a combined total of 5 kilograms of cocaine, almost 3 kilograms of methamphetamine, 2 kilograms of fentanyl, 11,132 dilaudid hydromorphone pills seized, and 30 firearms seized. Additionally, in these investigations, we have seized almost $80,000 in cash from suspected proceeds of drug trafficking, 1,875 oxycodone pills, 296 grams of crack cocaine, and 153 grams of carfentanil. The work of the Guns and Gangs section at holding drug traffickers accountable and protecting the safety of Londoners continues. We continue to work with other areas of the London Police Service, our policing partners, and our community at tackling drug trafficking in London. Thank you.
Thank you, Detective Sergeant Silcox. Next, we will hear from Scott Cordes, Executive Director of the London InterCommunity Health Centre.
Good morning. I want to thank the London Police Service for their partnership and the invitation to join you today. We at the Health Centre would like to offer our commitment to collaborating with the police and all health service providers in our community to address the issue of legitimately prescribed medications that are being diverted to the street supply. The medication seized by the London Police comes from many sources, and we expect that this commitment is shared by all health professionals who prescribe controlled substances in our community. The InterCommunity Health Centre exists to serve people who face barriers to accessing healthcare. People who use drugs are some of the most marginalized people in our community, and they are marginalized from health and social services. So we provide services to many people that use drugs. For some of our clients at the highest risk of overdose, our team prescribes alternatives to the toxic drug supply to reduce their risk of death and to improve their overall health and well-being through the provision of team-based primary care. Any clinician in our community can prescribe for this purpose if they believe it meets the needs of their patient. And we are aware of 3 other clinics in London prescribing alternatives to the toxic drug supply. The College of Physicians and Surgeons Ontario recognizes prescribing alternatives to the toxic street drug supply as an emerging area of clinical practice that is grounded in the principles of harm reduction and can enable physicians to support patients with opioid use disorder and reduce their risk of overdose and death. This is incredibly challenging work, done by a team of health and social service professionals each and every day, and I want to stand here and tell you how proud I am of those people. They show compassion, courage, and fortitude, and represent the best of public service. Diversion is a risk whenever a controlled substance is prescribed, including in programs that prescribe alternatives to the toxic drug supply. We take the potential for diversion seriously at the health center and have protocols to minimize the risk. Although we have confidence in our existing protocols, continuous improvement is a standard in all of the work that we do. As such, we are committed to engaging external expertise, including our partners at the police and public health and other clinicians, to review our protocols and offer recommendations for enhancement, as we do as standard practice with the work that we do. We do this work with the knowledge that we continue to lose community members to toxic drug deaths in our community, and we must not lose sight of that ongoing tragedy. We all here share a collective responsibility to redouble our efforts to address the impacts of an increasingly unpredictable and toxic drug street supply. While it is healthy to debate and disagree on strategies to end that crisis, our collective focus must be on ending that crisis. We cannot let our disagreements cause us to lose sight of this goal, which is why I'm here today to stand in partnership with other community organizations to show our commitment to having those difficult conversations. I know that we have the leadership and knowledge in our community to find solutions, and we look forward to contributing to those efforts. Thank you.
Thank you, Scott. Our last speaker will be Dr. Alex Summers, Medical Officer of Health for the Middlesex London Health Unit.
Good afternoon. Thank you to Chief Trung and the London Police and to Mr. Cordes and the London InterCommunity Health Centre for their ongoing leadership and partnership as we as a community continue to tackle the toxic drug crisis in London and Middlesex County. This crisis, quite simply, is the most pressing public health issue that we face. The loss of life and the emotional, psychological, and physical harms caused by this crisis are profound. There is certainly no single solution, and a multimodal response along all 4 pillars of prevention, treatment, enforcement, and harm reduction are necessary. Diversion must be managed, it must be mitigated, and the Middlesex London Community Drug and Alcohol Committee, of which the 3 organizations represented here today and others are members, will support the review of current processes to identify opportunities for enhancement across the London and Middlesex community to ensure that that diversion is managed. What is key is that we continue to see people suffering from addiction die in our community every day. Folks that are in situations well beyond their control, who are living in contexts, be it homelessness, acute mental illness, profound addiction, that result in death and profound impacts in our community. And as evidenced by all the speakers today, those impacts are felt very near to many of us. Our solutions require innovation, creativity, and most of all, partnership. It will take all of us collaborating and innovating to change the course of this crisis, to save lives, and reduce the broader harms related to the use of both prescription and non-prescription opioids in addition to other drugs. I'm profoundly encouraged by the commitment to a unified response in this community, as evidenced by the partnerships here today. And I want to recognize the tireless work of many health, social services, and community partners working together to respond to this crisis. Again, I would end by expanding my thanks again to Mr. Cordes, your team at the London InterCommunity Health Centre, and to you, Chief Trong, and your team at the London Police. Thank you very much.
Thank you, Dr. Summers. We will now take questions from the media. Please raise your hand when called upon. I will ask for your name and media outlet. Let me know who you would like to direct your question to. Randy?
Hi, Randy Richmond from the London Free Press. Any officer up there will do. Do you have a sense, or can you tell me if there's a sense that this is organized diversion? Is it like a lot of different people doing it, or is there some sort of overall plan among the criminal network to do this kind of diversion from safe supply?
I can take it. That's a good question, Randy. Like the drug trade, there's organized drug trafficking at the highest levels of organized crime, and there's drug trafficking at the street level. So we're seeing all of it. We're seeing this is no different than cocaine trafficking. Criminals will do what they can to earn a profit, and they'll exploit individuals in this community and other communities to earn that profit.
And it's clear that the dilaudid eights are coming from safe supply. They're not being imported from other communities. There's definitely a connection between safe supply and dilaudid eights on the street.
Yes, we are saying that here in London. I can tell you, Randy, that the street value for dilaudid eights or dillies here in London is anywhere between $2 and $5 for a tab. Outside of London, there's certain areas outside of this jurisdiction that the cost goes up significantly to $15. Some jurisdictions, even if you go up north, are $30 or $20. So the fact that London in and of itself has the street value at such a low price compared to other areas, that is a big concern for us. The law of supply and demand, if you have a lot of supply, you are going to have less cost for it. Other jurisdictions where the supply is not as abundant, that is where the price of the dilaudid are increasing.
I have one question for Scott Cordes, if I could. Scott, can you go through the protocols that you do now to attempt to stop diversion, what you think might have to be done in the review, looked at in the review?
Sure. So all of our patients who are prescribed safer supply are UTOXed at appointment. So they provide a urine sample to ensure that the medication that we expect to be there is in their system. And if it's not, that is an indication to us that there may be diversion that's occurring. And in those situations, our protocols allow for everything from removing the person completely from the program, because diverting a medication is breaking trust with their clinician in a very significant way. So we have removed people from the program if we have discovered diversion in clinic. There are maybe other reasons for it happening. Potentially, sometimes we work with highly marginalized people, so sometimes their medication may have been stolen, so they're victims of victimization. And in those cases, we work with safety plans with those patients and really try to individualize and understand what's happening in the person's life if it's discovered. We also get calls from London Police if they discover diverted medication with the name of one of our prescribers, and we address those situations when they come to us. Some of the other things that we do if diversion is discovered is we move from a take-home dose to an observed dose at pharmacy, which reduces the potential for the doses to make it into the community. So those are our protocols. I think, as I mentioned, there are multiple clinics in our community that are prescribing safer supply, and I'm uncertain of what their protocols are related to preventing diversion.
Can you tell me what your reaction to this news is and what gaps you might see that can be reviewed in your program?
Concern, we don't want to see prescribed medication ending up in our community. And part of the reason why we want to engage a wider group of people to look at our protocols is that fresh eyes could perhaps help discover opportunities for us to be doing things differently. I also hope that other prescribers who prescribe a safer supply look at our protocols as a standard and follow those protocols as well to ensure that we're all doing our part to prevent diversion.
My last question before I turn it over, are you the largest, is this the largest supplier of safe hydromorphine?
Our understanding is that there are more people receiving a safer supply from the three other safer supply programs in our community, but we prescribe to about 280 people.
Hi, Rita with CTV. This is for you as well, Scott. Now, you say you have efforts in place to avoid diversion, but clearly things are falling through the cracks. In terms of all of the efforts you have in place right now, do you, one, have numbers as to how many people you have removed off the programs based on the urine tests? And two, how are we going to move forward in terms of changing the way you're tracking all of this so that this doesn't continue to happen?
I think that those are things that we can discuss as a community drug and alcohol strategy, but I need to stress that we know that diversion is happening from safer supply. What we can't necessarily know as well as how much of it is coming from the program that we run and how much of it is coming from other prescribers in the community. So we only have control over the clinic that we run. And we've removed, I don't have the exact number, but we've removed a healthy number of people from the program when we've discovered the diversion, because frankly, we don't ever want to be at a media conference like this with all of you. That's why we take it seriously. But when our police partners and our public health partners have told us that they're concerned, we're concerned, and we want to work with them in partnership to do our part to tighten up if there are areas that we can tighten up.
Emily Pastfield, 980 CFPL. This would be for Dr. Summers. What would you say to people who hear statistics like this and say safe supply and consumption sites should be shut down?
Harm reduction broadly, which includes a number of different tools like consumption and treatment facilities, safer supply programs, are absolutely essential to ensuring that people don't die in the moments in which they're most severely suffering from their addiction. The immediate closure in this community of our consumption and treatment facility or the immediate cessation of a safer supply program would, I'm confident, inevitably results in increased deaths in our community in short order. One thing that I would highlight is that across Ontario and in British Columbia, where these programs are in place, and where the deaths associated with opioids are well cataloged and well studied, nearly most deaths, a vast majority of deaths associated with opioids are related to illicit drugs, fentanyl and other products. It is the unreliability of those illicit products that inevitably leads to overdoses because of the unpredictability of those products. When we look at a response to a drug crisis like what we are facing, as I commented, a number of interventions are required, from prevention, pathways to treatment, harm reduction to ensure that people are alive, and of course, enforcement of the illicit drug trade. All of those pathways have to be working in tandem. In the Middlesex and London region, we are dealing with the convergence of a profound homelessness and poverty crisis compounded with profound mental illness and addiction. That convergence means that the solutions are profoundly complicated. And it means that some of our stopgap measures, which frankly mean keeping people alive day by day, have to be utilized. The challenge with those stopgap measures is that they're nobody's ideal of a long-term solution, to be clear. And obviously they need to be enhanced, utilized, and monitored in such a way that we limit the other community impact and community harms as highlighted by the chief and his colleagues today. So I would highlight again, harm reduction is an essential component of a multi-pronged response to an acute crisis. The single most impactful health crisis that is reducing years of life lost in this country and in this region are opioid deaths. Young people dying before they're supposed to. and young people dying in the context of no social supports, poverty, addiction, mental illness. This is a public health crisis. And these folks are getting further victimized by folks who are running these types of drug trades. And that's why I, again, am so encouraged by the partnership between community providers and prescribers, public health, and of course the police as well.
And then this would kind of just be for anyone that's able to answer it. Why is there such a jump in diluted, if I'm saying that correctly, use between, I believe it was 2020 and 2021? I don't remember the exact years, but it just sounded like there was a really large jump in use then.
So the information that Deputy Bastian stated wasn't use, it was seizures. It was increases in seizures. So we're seeing year over year significant increases in the quantities of Dilaudid 8s in this community. And I just want to reiterate what Dr. Summers has said. And I thank Dr. Summers for being here and Mr. Cordes for being here. Their leadership is very important in this community. For us, this is not about safe supply. For us, this is about the diversion of safe supply and the impacts it's having in this community. I don't disagree with what has been said. There's a toxic drugs out there that is killing Canadians. The challenge that we're seeing from the police perspective right now with safe supply or diverted safe supply is that the prescription drugs are being used as currency and individuals are using the diverted safe supply to obtain fentanyl. And we know how dangerous fentanyl and the illicit drugs that it is made up of. That is a big concern for us.
Isha Bargava, CBC News. This is for Chief Trung as well. You had mentioned that the Dilaudids are being used as currency for other illicit drugs. How exactly are police able to track that?
That's from investigations. It's from intelligence information that we have, and that is from the investigations that we've been conducting for the last 6 months.
And just a follow-up for Scott Curtis. I know it's early in the process with the committee, but in terms of the review of safer supply practices, what are some factors that you will be taking a look at?
I think the factors that we want to understand are if our protocols are doing a good enough job preventing those that are prescribed medications from diverting them to the streets. That's the key factor that we want to look at. And again, we've looked at it. We're very confident in the protocols that we have. We think they serve us well, but we believe that by relying on some external fresh eyes and other perspectives that we may find opportunities to do better. But it's around trying to understand and prevent if medication is being diverted from happening. And again, it's concerning if people are trading a medication of a known dose for a medication that is more dangerous. We, again, through urinalysis and toxicology, don't see that in the patients that we support on a large level. But if we start to see that trend in the patients that we serve, that would be a concern for us.
I just want to clarify with the chief, so that's how the currency is working? People are trading hydromorph pills for fentanyl? Is that what you're seeing out in the street?
Yeah, that's one of the things we're seeing. And we're seeing that individuals and traffickers are collecting diverted safe supply and then reselling it in other jurisdictions where the profit margin is a lot higher.
And then using that money to, where does the fentanyl come in locally in that transaction?
So individuals in this community that we're seeing, they are utilizing whether they have obtained the Dilaudid 8s as a participant of the program, or they've trafficked it, or somehow it's gotten in the hands of other individuals. That now Dilaudid 8s that they have, they will trade, just as if they were purchasing fentanyl. They have an opportunity of currency now. So if you think about individuals that may not have an abundance of money or currency to support their substance disorder, they now have it in those pills.
Is there any sense, I know this is getting into the weeds here, but is there any sense of how much how much the value of hydromorphone versus fentanyl is right now in the street?
I'll turn it over to Detective Sergeant Silcox.
Thank you, Chief. As Chief mentioned earlier, a typical hydromorphone Dilaudid 8 pill is roughly $2 to $5. And for purposes of fentanyl, the amount of personal use fentanyl that someone would typically use would be roughly about $20 to $40, depending on the individual.
We have time for 2 more questions.
Just one more question. If you could reiterate the weapons behind you and how those are related to the seizures and the diversion, just sort of explain that for me, if you don't mind. Thank you.
We conduct thorough investigations. Thank you for the question. The investigation could start out as a drug investigation, but in the process of that, we may come across firearms in our investigations, and sometimes firearms are linked to those that traffic drugs in our community.
Thank you. And one last question, if this is still on, for Chief Trong. Just to clarify, this is your support for safe supply is still there despite the evidence of diversion. You were still, like the London Police is supporting the programs that are essentially leading to this diversion?
So from a public safety perspective, my job is to make sure that the community is safe. That's our responsibility as an organization. Part of the drug strategy involves enforcement, and that's where we come into play. So with respect to safe supply and models of healthcare, I rely on the experts to provide that guidance. That's the federal government, the provincial government. Our job here today is simply to share the concerns that we're seeing in this community and the impact it has in this community. So we will continue to do enforcement on drug trafficking in this community, which includes the diversion of safe supply.
That concludes today's press conference. Again, thank you all for joining us. We will post the media release on our LPS website and social media channels shortly. For those interested in viewing the seized drugs and firearms, you're welcome to take photos of the items on display. For media outlets joining us online, please send us an email and we can send you the photos of the seized items as soon as they are available. Thank you.